Allow me to introduce you to a scenario about maternal mental health awareness. Carla is 5 months pregnant. She also has an 18-month-old son. She has been feeling much more tired lately and notices that she easily gets frustrated and irritable. She sometimes yells at her son. She's been having difficulties falling asleep. She's been eating a lot more and doesn't feel like herself. She doesn't want to share her feelings with her husband because she thinks he won't understand. She has shared her feelings with some of her female friends, and they have provided some emotional support saying everything will be fine. It's just a phase during pregnancy.
In a situation like this, we must be cautious of how we respond. In Carla's case, we had been providing home visits, and on this particular day, I noticed Carla wasn't herself. The first step we take is to acknowledge any feeling or emotion she's dealing with. Carla began sharing the difficulties she was having. She said she was tired all the time. She spoke about being frustrated over simple tasks and that she has been eating a lot more. I acknowledged her feelings and reassured her that we can work together to get her better. I spoke with Carla about the contributing factors that would cause her to go through what she has been feeling. We spoke about hormonal imbalance being a contributing factor. We even discussed how important it is to speak with her husband about how she's feeling. She was open to everything. She even felt a little less anxious. The reason these discussions are important is that it allows us to partner and collaborate with the client to further explore individual circumstances and needs. The conversations are designed to strengthen personal motivation and empower the client to take the next step towards optimal health and well-being. Screening is a process for evaluating possible presence of a particular problem. We utilize the Patient Health Questionnaire and Generalized Anxiety Disorder to screen for depression and anxiety. Depending on the response, we can determine how to explore options available to Carla for her mental health. This could be something like reminding her of the Maternal Mental Health Hotline and seeing what mental health provider options are available to support her. In some cases, an immediate response may be needed. Some women can suffer from psychosis during their perinatal period. Psychosis during the perinatal period is the severest form of mental illness for a mother. They can suffer from extreme confusion, loss of touch with reality, paranoia, delusions, and even disorganized thought process. We were very lucky this was not the case with Carla. Talking to her and acknowledging her feelings really helped a lot. Knowing that she wasn't alone and had multiple ways to reach out uplifted her spirits. She will be following up with her mental health provider, and of course, I will be checking up on her to see how she's improving.
A public health nurse knows that mental health conditions like depression and anxiety are the most common complications during pregnancy and after childbirth. This can affect an estimated 1 in 5 pregnant and postpartum people in the United States. With the growing increase in perinatal mood and anxiety disorders and its impact on maternal and child health outcomes, home visiting nurses play a vital role in promoting assessment and screening of maternal emotional, social, and mental well-being during the perinatal period. For more information, please visit Fairfax County Health Department, Maternal and Child Health Program website.